We're joined from our studios in Durban by Dr Sibongiseni Dhlomo. He's the KZN Health MEC. Dr. Dhlomo, good morning to you. Thank you so much for coming through.
Good morning, ma'am, and good morning to all the viewers.
Now, let's just start by focusing a little bit on the state of public health care in the province. We do know, MEC, that it's always been a concern to many residents as well as cancer patients waiting for treatment. How dire is the situation before we look at the impact the machines will have?
The province, ma'am, is draining the whole of KwaZulu-Natal, part of the Eastern Cape, and some of the patients, they walk in from Mozambique and Swaziland. So it's quite a significant number. But what we are looking at are those patients who are at a very advanced stage. If you look into the cancer population, the patients who probably have got an advanced tumor, and that's about 20%. So, and the other impact that we have, you may start the year as we start, not aware that soon in the middle of the year, there are patients who have been looked after by the private sector, and when they actually run out of medical aids, then they become patients of the state, and therefore that burden suddenly increases, and it is actually quite huge. And the other problem is this very late detection of cancer. So we are actually doing our best to deal with the 20%, because that is what actually becomes advanced cancer. But really what we were doing yesterday is dealing with the other 80% of patients that we don't want to move into this 20% of advanced cancers.
But we do know, MEC, that there were also concerns around the backlog. Talk to us about the interventions that the department has put in place.
Ma'am, you probably realize that this matter is a national issue. That is why in the State of the Nation address, our President Ramaphosa mentioned this matter as one of the focus areas for health. And we also, you are probably aware that all the 9-year-old in the country, women, young girls, are actually vaccinated against the HPV, human papillomavirus. The plan is that when these women get into becoming young women at about 30, they have significantly reduced the risk of being exposed to cancer of the cervix. Now, long time ago, we used to know cancer of the cervix as being a postmenopausal bleed. Women who are around 50, 55 years of age. Suddenly, we have seen age as young as 30 years, women getting cancer. Hence, in the province, we launched a campaign that we call PILAMA, focusing mainly on young women and screening them for cancer. We have done relatively well, but we have increased the pool of those who need services. And we have done well in terms of curing them, because if you really find cancer, a small lesion early enough, you are going to be able to cure them. But for those that have been now going to our bigger hospitals, yesterday we're now buying these machines, which are going to be decentralized to many other rural hospitals, because these machines can actually confirm and excise that small transformation zone in the cervix, and it is almost going to lead to cure. So we are going to really find a reduction in terms of women who would have to wait for actually going to the bigger hospitals through using these machines.
Yeah, the situation is indeed, of course, a challenge, MEC, because today we lose women as young as 30 years to cervical cancer. So the machines, really, this new technology, how different is it from the ones that the public hospitals currently have?
We do have also these machines in some of the public hospitals, but these ones now are going to the rural hospitals. Okay. What they do, ma'am, you still go to do a pap smear of what you call a cytology-based procedure, where you actually see if there are abnormal cells in the cervix. This machine is going to look into that patch and excise it right there and there. You don't have to now go to Nkosi Albert Luthuli, you don't have to go to Itindale or bigger hospitals. At Nkandla Hospital, Christ the King Hospital, further out there, doctors have already been trained to excise that small lesion, and that is going to lead to cure. So there's not going to be any waiting period. Today, a woman gets results of a pap smear. Within a week or two, we can put her through this machine and therefore excise that small lesion, and that is going to lead to complete cure. And none of these women will now go to have advanced cancers if we really go on a massive campaign to do this in all our areas and not wait for those bigger hospitals to do it.
Yeah, I would also imagine it's advisable, MEC, that more women should go for their pap smears. But now, in conclusion, quickly, has the department been able to employ more oncologists and perhaps health workers sufficiently trained to operate these new machines?
These machines, ma'am, will need an ordinary doctor like me who is just a medical officer to be trained how to use it. And that is why we are sending to district hospitals, because district hospitals don't have oncologists. Our oncologists that we are training, some of them we have sent to Free State Province, Western Cape, and in the Grace Hospital, are going to be trained and come back to beef up at Teguini, mainly Addington and Inkosi Albert Luthuli. But that is for the very advanced cancers where they are doing the whole range of chemotherapy, radiotherapy, and surgery. But these machines are not going to be actually helping us at that level. There's a very advanced 20% of our patients. These ones are going to mop up every part of the province. Every district hospital will have a doctor who will be able to train, because it's going to be like cutting up a small part where we could put women in a lithotomy position and therefore excise that small patch that we find, cauterize it there, burn it up, and then the woman goes home the same day or the next day cured. So it does not need oncologists, this part. It needs ordinary medical officers whom we have trained in all our districts.
All right, MEC, we have to leave it at that. Thank you so much for coming through. Dr. Sibongiseni Dhlomo is the KwaZulu-Natal MEC for Health, of course, talking to us about the acquisition of cervical cancer machines that are aimed to detect, prevent, and